Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we address problems in the healthcare system and take actions to try and make the system better for all of us. Today we're going to talk about Medicaid unwinding. This is one of the effects of not having universal health care. Okay, some background. Medicaid is a joint federal and state program that, together with the Children's Health Insurance Program, CHIP, provides health coverage to many Americans, including children, pregnant women, parents, seniors, and individuals with disabilities. Medicaid is the single largest source of health coverage in the United States, and during the pandemic, it covered about 94 million of us. To participate in Medicaid, federal law requires the states to cover certain groups of individuals: low-income families, qualified pregnant women and children, individuals that receive supplemental security income, SSI. Those are examples of mandatory eligibility groups. But states have additional options for coverage, and they may choose to cover other groups too, like individuals receiving home and community-based services, and children in foster care who otherwise are ineligible. Now, before I go too far, let me remind you, down below in the description box is going to be a link to an Healthcare Advocacy Newsletter that is the text for this video. And all of the links and the references are in that newsletter. And you'll need that for some of the actions. Okay, the Affordable Care Act of 2010 created the opportunity for states to expand Medicaid to cover nearly all low-income Americans under age 65. If I can just take a brief aside here, it was almost at next to no cost for the states to do it. So if your state didn't do it, shame, shame, shame. Okay, sorry. Eligibility for children was extended to at least 133% of the federal poverty level in every state. And although most states cover children to higher income levels, and states were given the option to extend eligibility to adults with income at or below 133% of the federal poverty level. Now, this is the Affordable Care Act expansion. Most states have chosen to expand coverage to adults, and those that have not yet expanded, good news, you can do it at any time. Okay, sorry. When the pandemic hit, Medicaid was expanded even further to make sure that more people could be covered and to save lives and to slow the spread of the virus. Because in a public health emergency, the more people who can get medical care, the better it is for the whole population. Okay, now the other thing that the government did was that those on Medicaid did not have to re-enroll each year, because you know what? If you're locked up with COVID, it's really hard to go re-enroll. Okay, this past spring, the COVID-19 pandemic was declared officially over, and so it was time to return to the pre-pandemic rules for eligibility for Medicaid and CHIP. Now, the Kaiser Family Foundation has been tracking this unwinding. The unwinding is the return to the original rules for Medicaid eligibility, and it winds up throwing people off. That's what we're going to talk about. At the height of the pandemic, 94 million of us were using Medicaid. So that's about 30% of the US population. So far, states have reviewed the applications, remember everybody has to reapply, for about 28 million people. And this is bad news. First, they've only reviewed 28 million, so there's 71% of the population on Medicaid left to go. And of the 28 million they reviewed, more than 7.3 million have been denied coverage. That's about a quarter of those. And of that 7.3 million, more than 5.1 million were removed for procedural errors, such as not responding to requests for information to verify eligibility, or they moved, or they don't speak English, or the forms were difficult for them to fill out, whatever. They may actually be eligible, but they're not getting medical care. And worse yet, 1.8 million children in 20 states have been removed from the Medicaid rolls. This is not good. Okay, so state and local Medicaid offices, well, I'll give you their side of the story, say, well, they've tried to contact enrollees in multiple ways, including through letters and phone calls and emails and text to check eligibility, that some Medicaid recipients lack consistent addresses or internet service or do not speak English or are juggling more pressing needs at the moment. In fact, there's going to be a link to a Kaiser Family Foundation story on this in the newsletter. And in there, they mention one person who contacted Medicaid and said, I'm eligible. Why can't you put me back on? Why are you denying? And they said, oops, we just misplaced your application. So there's a lot of problems. All right, denying coverage wrongly for these patients puts them in just a horrible bind. If they become ill, medical care for them, these are generally poor people. It's unaffordable. Chronic illnesses and required medication are ignored in favor of things like food and shelter. In the newsletter, there is a graphic, and I cannot do justice to it here in the video, but I'll tell you, the number one state for removing Medicaid applicants is Texas, and the number of people they've denied coverage to is about 1.2 million. Way to go. Okay, anyway, some of the people legitimately removed from Medicaid, they make too much money now. One person who was mentioned in the Kaiser Family Foundation story was a single mom. She has 2 children. Good news, the children have medical care. They got onto the CHIP program. But she makes a whopping $22 an hour. Now, the Affordable Care Act offers her reduced premiums so she can go buy a policy. Sadly, that policy is $260 a month. Now, let's think for a minute. Let's assume she pays no income taxes at all, federal or state, and she only has to pay Medicare and Social Security. If you take that into account, that $260 a month is 8% of what she takes home. It's no wonder she can't afford it. All right. Of course, with universal health care, we wouldn't be having this discussion. I'm just saying. Now, there's an action you can take. And let me give it to you, because this is the kind of thing our representatives need to hear about over and over again. So let's let our representatives in Washington know about this tragic situation that's unfolding, because they can do something about it. They can pass universal health care legislation to cover all of us. Cradle to grave, increase the availability of providers in medical deserts, and do it for far less than we as a country spend right now. I mean, like way less. You can find your member of Congress and senators' contact information if you go to the newsletter in the resource section. There's a number you can call to call them, or you can get their email address. Or if you have a cell phone, you can use ResistBot to send them an email by texting sign, S-I-G-N, PKAGSJ to the number 5049. And I'll read you the message. I'm your constituent, and I want you to know that states are dropping people from Medicaid for procedural reasons. Incomplete forms, address errors, language issues, and not because they make too much money. This is the unwinding of Medicaid post-pandemic. About 28% of the 94 million Medicaid recipients have been reviewed, and about 5.1 million have been dropped for these procedural errors. Many of these people have no way to afford an ACA plan, even with discounts. I'd like to point out that of those losing coverage, 1.8 million were children. Now, there's nothing good about any of this except for the fact that you, my representatives, can fix it by enacting universal health care. I recommend H.R. 3421, the Improved Medicare for All Act. It covers all of us, cradle to grave, increases the availability of providers in medical deserts, and does it for far less than we as a country spend now. I know, saving democracy takes a lot of energy, and everybody's really busy, but we need to be able to be healthy enough to enjoy that democracy. I strongly urge you to enact universal health care now and stop this madness. Thank you. Let's go on to another subject, which is, it's not a fun subject, but we need to know about it. It's lung cancer. There's also going to be a link to this full article in the newsletter. Lung cancer screening guidelines have been updated for people who used to smoke cigarettes or who continue to smoke cigarettes. Most lung cancer screening guidelines hinge on how much people smoke tobacco and when they last smoked. But the American Cancer Society now says it doesn't matter how long ago they quit. On Wednesday, that's yesterday, because today's Thursday, November 2nd, the ACS, the American Cancer Society, released guidance recommending that anyone with a significant smoking history get an annual low-dose CAT scan for lung cancer. Now, I was a really heavy smoker for a very long time. So let's just see if insurers decide to cover this one. Watch this space. Let's talk briefly about reproductive rights. Abortion is essentially banned in almost half the United States. Those states treat women as second-class citizens incapable of being able to control their own healthcare decisions. Some have made it illegal to facilitate someone getting an abortion out of state, like giving them a ride to the airport or driving them to an adjacent state where abortion is legal. This is police state activity by people who behave just like the Taliban. Remember them? Okay, anyway, there are 4 pieces of legislation in Congress that can change this. They are, number 1, the Women's Health Protection Act. It codifies Roe v. Wade in federal law. Number 2, the Ensuring Women's Right to Reproductive Freedom Act, to affirm the right to travel to receive legal abortion care. It protects patients, providers, and anyone else who helps someone travel for care. Number 3, the My Body, My Data Act protects personal reproductive data by creating a national standard for what data can be collected, saved, or shared. Actually, in the state of Washington, we have that because the data was out on apps and people were selling the data, and so you got to be careful. Anyway, so My Body, My Data, and the Abortion Justice Act does that, just that, by addressing the systemic barriers in racism to reproductive health care, ensuring that everyone everywhere can actually get the care they need. Okay, now that's a lot to write in a letter to your congressperson, and you can do it. I encourage you to do it. Just cut and paste. Or I actually wrote this as a letter to the editor, and I'm in the newsletter is a link to the letter I wrote. It was published in our Pacific Northwest Columbian newsletter, and you can just click on it, cut the letter out, modify it to fit your neighborhood, because I actually mentioned my congressperson in there, make it fit your neighborhood, and you send it to a newspaper in your area. So that's the extra credit action. Send a letter to the editor to newspapers in your area asking that your congressperson support those 4 bills. That's it. Okay, that's it for today. Down below, like, share, and subscribe. You can subscribe to the Healthcare Advocacy Newsletter. You can get these as emails every day in your inbox. And that's what I have for you. Send comments and suggestions. Thank you. Bye-bye.